Most people don't know the difference between a dietitian and a nutritionist, and it is pretty confusing. Even some of the doctors that I work with aren't quite sure. I've been a dietitian for 24 years now, and this is one of the most common questions that clients ask me, actually almost every day. So today I'm going to break down the main differences between dietitian and nutritionist and talk about why that matters to you. So, registered dietitian, RD, we are trained nutrition and food experts. And we're able to take that complex scientific, medical, and nutrition evidence and turn that into practical advice. We help people work on their diets to make sustainable changes in order to improve their nutrition, health, and well-being. Registered dietitian, and RD are all protected titles in Ontario. So what that means is that in order for someone to use those to describe themselves or to put those credentials after our names, you know that we've met with some pretty rigorous educational and professional standards. And I'm going to go over what those are now. So the very first thing is that we need to have a bachelor degree in science or applied science with in nutrition or food and nutrition from an accredited university. So that means it's accredited by the College of Dietitians of Ontario, that it meets their standards for education in this area. And right now in Ontario, there's only 3 schools that meet that are accredited. So my alma mater, TMU, Toronto Metropolitan University, which was not called that when I went there eons ago, which is probably why I stuttered when I said it, the University of Guelph and the University of Western Ontario. So we come out of one of those 3 schools, and then back in the day, way back when I did it, most of us actually came out of school and went straight into our internship. But I say straight into because a lot of people don't understand that it's pretty competitive to get an internship, and probably half the people didn't get it. So at that point, we move on to our internship, which is unpaid. At least back in the day, it was unpaid, and it's about a year long. And in that time, I was in a hospital doing clinical in pretty much every area of the hospital. And then I had an admin rotation for the other half of the year, which was in another hospital in the kitchen. So we basically have to do clinical rotations and administrative rotations, and not everybody does their administrative rotations in a hospital, but I did. And I want to pause there and say, nowadays, I actually supervise interns in their placements, and they're not usually coming out of an internship program. Most graduates now come out of their bachelor degree and actually go straight into a master's degree. And the master's degree is integrated with placements. And so people can still do the route that I did, but most people graduating from nutrition to be dietitians actually have a master's degree. So now we've covered 2 things. So either a bachelor's and following an internship, or we do bachelor's, master's that are integrated with placements. And then once that is completed, the next step is to sit and write the regulatory exam. And once that is completed, we can actually put those credentials after our name, but that's not where it stops. So then we have to constantly, every year, we have to update, make sure that we're staying up to date by setting goals. So every year I have to set 2 goals, and most of my goals do involve me getting some more education, so that kind of goal, but it's really any kind of goal. But the point is that we're accountable to the college, that we uphold the standards of the college by continuing education and so forth. Collaboration is at the heart of our practice. And we work with other health providers like doctors, nurses, pharmacists, social workers, you name it, we work with them. And we all collaborate together in order to work with clients to provide nutrition and health information to improve their health. So we do health promotion. We also help manage chronic diseases and improve health outcomes. As RDs, we work in many different areas. So, for example, I work in a family health team. So, that is a primary care team, basically, that consists of all those providers that I just mentioned. So, physicians, well, more than that, actually. So, physicians, nurse practitioners, nurses, social workers. We have a physician assistant, pharmacist, and us, dietitians. And that's just what I do in the day. During the evenings, I also have my private practice, which is in my link below. So I work in 2 areas, and I've worked in other areas prior to that. And I have a list here that I'm going to read because I'm not going to remember what all of them are, but just to show you the different areas that we can work in. So hospitals, community health centers, home care, long-term care homes, diabetes education centers, public health departments, sports and recreation facilities. And I know that there are some dietitians that actually work with sports teams like the Raptors to help optimize their performance through food and nutrition. The food industry, and also academic and research. So does that surprise you, other than the 2 that I already said? So does that actually surprise you? Because I feel like it should, considering the way that people often ask me what a dietitian is, because I feel like most people think that all we do is work in hospitals and wear lab coats and wander around to patients' rooms and ask them what they want to eat. That's a diet technician, FYI. So we do a lot more than that, and I hope that that's coming across. So what about nutritionists? Well, in Ontario, nutritionist is not a protected term. And so what that means is that you don't really know what you're getting when you have a nutritionist. You could be getting somebody who has gone to school and taken nutrition classes and maybe even gotten a certificate. Or you could get somebody who has no formal training at all. So dietitians then are the gold standard because of all that rigorous training I told you about, plus the fact that we are all standardized in the sense of we all have the same education and we all have the same similar training to get there, and we've all written the same standardized exam. So we are the gold standard for nutrition care in Ontario, and we are able to use evidence in our practice and help improve the health outcomes of people with even complex chronic diseases. Another difference between dietitians and nutritionists is the requirement for evidence-based practice. So what is evidence-based practice? As dietitians, we are legally obligated to provide patients with the most up-to-date scientific research and guidelines. So when I'm making recommendations, those are at topmost in my mind. Some nutritionists also practice this way, and I think that's awesome. However, that's a choice. For us, it's a legal obligation, and I am at risk of losing my license if I am not practicing ethically and safely. That being said, being rooted in science does not mean that we can't take a holistic approach to nutrition, and I'd like to think that most, if not all of us, do. We know that we have individuals in front of us and not just some textbook. So we take into account people's preferences and culture, and along with many other things when we are making our recommendations, but those recommendations still come from a science background. I hope I've helped clear up any kind of confusion you might have had between the terms dietitian and nutritionist, because it's important to understand the difference between the 2 when you are coming to make informed decisions about your health. As dietitians, we're here to help you make lasting, evidence-based changes that can improve your health and well-being. Whether you're managing a chronic condition, aiming for better overall health, or simply want some guidance on making smarter food choices. I'd like to leave you with one final thought. Every registered dietitian is a nutritionist, but not all nutritionists are registered dietitians. So if you're ready to take that next step towards nutrition and health, I'd love to help you. Just reach out and book a consultation, or if you have a question, feel free to drop it in the comment box below. And don't forget to like and subscribe so that you can continue to receive these nutrition tips and updates. For now, take care.